Joining me now from our bureau in New York City, entrepreneur, founder of Waitlist Zero, and kidney donor, Josh Morrison. Josh, healthcare costs, we talk about those. In the aggregate, it costs American taxpayers more for kidney disease and treating kidney patients than it does to fund the entire Department of Homeland Security. And one of the reasons is because of the laws and regulations that are in place right now that restrict kidney donations.
Graham, thank you for having me on. And so that's right, that there's a federal program already that reimburses just travel for donors, but that's because it's very restricted. What President Trump did last week was to expand that program to increase donation by reimbursing other expenses like lost wages and childcare, which average about $4,000 for each donor and obviously really inhibit donation.
And the White House, the president, is using effectively what you've come up with as a model for this reimbursement program. And by your projections, based on a lot of evidence, some of it outside the United States, we'll get to that in a minute, but your projections is that kidney donations may increase by at least 25% if and when these go into effect?
That's exactly right. So like I said, right now there's about 5,500 kidney donors each year. There were 6,500 last year. And so if you were able to get 25% more donors each year, that'd be 1,500 lives saved each year, just based on this very simple policy of preventing people who are kidney donors from having to go into credit card debt or pay money out of their own pocket just to save someone else's life.
Now, you created a coalition to advance something like this. Again, this is what the president based his model on, the White House based its model on, is your coalition to promote living donations for kidneys. And among some of the things that you're trying to do here is prioritize the reimbursement, encourage kidney donations overall, reduce the donor expenses that are involved in donating a kidney, and ultimately, of course, saving lives. But I would throw in there one more thing, that this is a proactive attempt to save not only lives, but also taxpayer dollars.
Yes, that's exactly right. So right now, Medicare guarantees coverage for patients with kidney failure, even those under 65. And so if you have kidney failure, like about more than 500,000 Americans do, your alternatives are transplant or dialysis. And just for Medicare, each year of dialysis costs $90,000 per patient, whereas each year for a transplant, if you average the cost of the surgery over just about 5 years, it costs about $30,000 per patient. And transplants actually last about 15 or more years from living donor on average. So you can imagine this massive cost savings. And just with a conservative estimate of 5 years of that, about $250,000 per patient. So if we were able to get 1,500 more transplants a year, that's hundreds of millions of dollars in saving to the federal budget. There was a recent study that found that for the current program that just reimburses travel, for every dollar that's spent, $28 are saved in Medicare expenses.
Tell me about your story. You donated a kidney. What was the circumstances? What prompted you to do so?
So I donated my kidney about 7.5 years ago on December 13th, 2011. I remember the date pretty well. And it was actually to a stranger. I didn't know him at the time. His name is John Mendez. We got to meet a few months after I donated. And it was incredible to meet him. We got along really well and we remained close. And I started donating when I read an article, or started thinking about donating, when I read an article by a woman named Sally Sattel, who's a kidney recipient and an advocate for incentives for living organ donation. And the article said, two things that really struck me. One was you can save someone else's life, and the benefits to them far, far outweigh the risks to you, which the biggest risk is you have about a 1% increase in your chance of kidney failure. And second, her story really caught me, where there are 3 different people who said yes, they would donate and then backed out. And that feeling of kind of loneliness or of worrying that someone else is going to save your life, that really connected with me emotionally. And I didn't donate right away. It took me a few years till I ended up doing it. But that's kind of what started me on the process. And it was a great process and something that made me incredibly happy.
And obviously, you had some expenses you incurred in doing this, in this wonderful maneuver on your part, this very generous maneuver. But obviously, there are expenses incurred, and that brings us back to the reimbursement. When we look outside this country, Israel is a pretty good example of a system of reimbursement that works and has proven to increase donations.
Yeah, that's exactly right. So in 2008, Israel passed a law that was broader than what the administration just did. They did not only lost wages, but they also provided some amount of health insurance and life insurance benefits. And in the 10 years since that law has passed, their living donation rates have quadrupled.
Want to see more videos like this? Click on the link below and subscribe to One American News on YouTube, and call your cable provider and kindly demand that One American News is added to your lineup. Call and subscribe today.